Medicine shortages are having a marked impact on pharmacies, with more than 90% reporting frequent delays in patient treatment due to low stock. There are currently 428 ongoing medication shortages, 36 of which are critical for conditions including diabetes, ADHD and menopause. Dr. Jack Janetsky is from the University of South Australia and is also a pharmacist. Welcome to you, Jack. So let's start there if we can. What are your experiences as a pharmacist of telling people that you can't supply them with a particular drug because of these shortages?
Yeah, it can be really distressing for patients who are unable to access their medicines. Just recently, in the last few days, I've worked in the pharmacy, and it's quite often that you're having to say to people, I can't supply your medicine. I can try and contact your doctor or another pharmacist to get you your access to your medicines, or an alternative. But yeah, it's definitely quite challenging out there.
So why are medicine shortages so bad?
So currently, Australia's in a unique position where 90% of our medicines come from overseas. And because of that, we're sort of at the mercy, I guess, of the overseas market, and getting medicines into Australia can be quite challenging, especially when, perhaps there's a natural disaster or maybe there's some manufacturing issues. That's what contributes to the shortages here most of the time. But also demand as well. We've seen an increase in demand of some types of medicines, which has led to significant shortages here.
Like what? Which medicines are those?
So some medicines for weight loss and also some medicines for attention deficit hyperactive disorder, or ADHD. Yeah.
So these shortages have been going on for a while?
Yeah, so some medicine shortages have been going on, I guess, since the beginning of COVID or even beforehand. At the moment in Australia, menopause medicines, particularly the patches, are quite hard to get for hormonal treatment of menopause. And that's been going on for at least 2 years now, and the same story for some of the weight loss medicines as well.
Right, you spoke about your experiences. So how often can you offer an alternative to people if you don't have the prescribed drug in stock?
Yeah, it really depends on what we have and what's currently coming through from the wholesalers. Most of the time we can try and source something or an alternative for the patient, but it really depends on I guess, which wholesalers we have access to, and also the different, I guess, regulatory approvals in place at the time, because we need special approval from the TGA if we're going to swap a dosage form of a medicine, or say a tablet to a capsule, or the different strengths of the medicines as well.
Are pharmacists also able to direct people to other outlets which do have particular drugs? Is there a central database that lists the drug stock of other pharmacies?
At the moment, there is no central database. There is the medicines shortages database, which tells us which medicines are out of stock nationally and which brands they are. However, I probably would advocate for some sort of centralized database, which doctors and pharmacists could access to see, who nearby actually has stock. That would be very beneficial.
And how often can you offer an alternative to people if you don't have the prescribed drug in stock?
Yeah, so most of the time we try and keep a number of brands in stock where possible. But as I said, it really depends on how many brands are on the market in Australia. Yeah, that's probably one of the main things that is a factor, is which brands we have in stock, and how many are listed on the PBS as well.
Okay. And are pharmacists told when national supply of a drug is running low so that they can prepare, as much as you can?
Yeah, we can sign up to the alerts from the medicine shortage database. So we are told about when they're coming, but obviously we can't predict every shortage, and neither can the medicine regulators either. So, from time to time, there are instances where we just can't get ahead of the situation and ensure that we have enough stock before, the patients are affected.
Right. And as a pharmacist, Jack, do you have to ration supply, perhaps not fill out a full script, but give people enough so that they're not completely without the drug that they need?
From time to time, that has been something that some pharmacists and some pharmacies have implemented in the past. Yeah, so that has happened in consultation with the patient and their doctor where it's needed to happen. Right. But where possible, we try and get them their full supply as soon as we can.
Yeah. And can some of these short supply drugs be made locally here in Australia?
So sometimes they can be made by compounding pharmacies, but again, that comes with an additional cost, because that item would no longer be covered by the government. It would be what we call a private supply. I guess manufacturing medicines on a larger scale here in Australia comes with a cost onward effect there that, is maybe not as justifiable as, making medicines in mass production overseas and importing them into Australia.
So nationally, Jack, what's being done to address these drug shortages?
Yeah, so just in the last few days, the Australian Medicines Association, or the AMA, and the Pharmacy Guild have put forward a submission to the TGA to reinstate the Medicines Shortage Working Group, which was disbanded, I think, in 2021. And so hopefully that would be able to provide some more high-level, I guess, information and strategies for helping to deal with medicine shortages in Australia.
Isn't there, though, a national stockpile of drugs for use in health emergencies? Has that been dipped into?
Yeah, so there is a national stockpile, but that's more for critical medicines, so potentially antibiotics and life-saving medicines as well. So not every medicine is on the national stockpile, unfortunately.